So great to see you all. Um, and I'm going to aim to take you through. This is a very wide subject. I might not be able to do justice to it in the time that I have, but hopefully you'll have lots and lots of questions after I present it, and I'm looking forward to lots and lots of questions. All right. So what we're going to be talking about today is co-creation with data and digital, and what does it actually mean? um, and actually an assessment of the current BI capabilities. BI is business intelligence to support shared decision making. So first of all, so you probably heard I come from the healthcare business. We are in the business of providing publicly funded healthcare in NHS Wales. Um, NHS Wales is a part of the bigger organization. Again, NHS is publicly funded in the UK for those who might not be aware of this, and actually has similar challenges to the rest of the healthcare industry globally. I'll use this sentence here. If we look at Uber and Airbnb, outcomes of what is happening to the consumer are being measured immediately. But in healthcare, we don't usually do that. And I'm going to illustrate this with a few examples. So we do need to start doing that. So in that sense, what does co-creation mean actually in healthcare? So I just want to kind of spend a few minutes explaining what is co-creation. So, as educated consumers, we want more involvement with the products and services that we buy. So, hence, healthcare needs flexible, smarter ways of providing services that make the very best use of resources and deliver the outcomes that matter to patients. Now, what are outcomes really? Outcomes are really the results that people want to see from their treatment. And when we ask people what do they want, healthcare becomes more personalized. Why does that happen? That happens because people become more involved in their care, and hence people choose more conservative treatments because they feel it's right for them. And that's what we mean by co-creating in healthcare. An excellent example of this is um, a person whose goal is to walk to their allotment to do some gardening versus somebody who wants to run a marathon, right? When these two people come to the healthcare service, for one, a knee replacement might be a good idea. For the other, just helping them with some physio and mobilizing their joint could be other. So it's important that we ask people what they really want in terms of their care. Now, the topic we're going to try to cover today is how do we co-create with data and digital? So what I'm going to be talking about in the next few slides is what do I mean by an outcome measure? And particularly, I'm going to focus on what is a patient reported outcome measure. Why does it need to be embedded in the clinical workflow and patient pathway? The importance of data standards and interoperability. And the main thing for today's topic is, do we have the business intelligence capabilities in our organization to actually hear our patients, hear our citizens, and get into that co-creation mode? So what is a patient reported outcome measure? A patient reported outcome measure is a standard health assessment questionnaire, something that you see on your screen. It's got standard domains in terms of which we measure things like physical limitations, symptoms frequencies, quality of life, and social limitations. And at the end of it, it gives us a summary score. Traditionally, these assessments have been done on pieces of paper. And again, these assessments these are globally recognized licensed products. What you see on your screen is called the KCC12. It's called Kansas Myopathy Questionnaire, which is used typically for heart failure patients. Traditionally, these have been done on pieces of paper and hence cannot be used at patient scale. So first of all, it's really important to digitize this process and incorporate that in patient workflow. And what do I mean by that? I mean by that is when a patient has to come to their appointment, won't it be great if they fill in this questionnaire with the information that's relevant to them, i.e., I'm unable to walk about, I have slight problems walking about, I have no problems in walking about. and actually submit this information to their clinician before they came in and saw the clinician, so that the clinician would be able to view this information and be able to focus what matters to the patient most. So that is what a patient reported outcome measure does. If filled correctly at pace and scale, it gives the clinicians the ability to asynchronously look at this information even before the patient comes in. And Richard alluded to this in, earlier when he introduced this particular conference. What has changed in our workplaces? So in healthcare, COVID has created an enormous backlog, and we need to start thinking differently. There's an enormous backlog in terms of people who are waiting for treatments now. So we need to kind of think about the mechanisms that we need to incorporate in our workflows to be able to manage more patients in the same time, because resources remain scarce. Our staff is tired. They're exhausted after this pandemic. So, how do we ensure that we give them the right tools and mechanisms to use some of this information asynchronously to be able to deal with a significant volume of patients coming in? Again, I'm just going to show you another visualization of how prompts can be visualized longitudinally over the patient journey, and how you can see the the change from when they first came in, to now. So you can see from this one here that over, from the first few appointments to the next, their walking 100 yards has been moderately limited, and their anxiety has increased from not being anxious to getting more anxious. Now you might ask me this question at this point, well, how do you go about this, right? So actually the way we go about this is it's triggered off from a phone, from your appointment reminder. The patient is sitting comfortably on their sofa, filling in the prompt. It goes to the clinician who reviews it. And as we collect more and more data, again, this data can be used in group consultations, rather than one-to-one. And as we collect more data, artificial intelligence and machine learning can help us get better at using this information and using it more effectively. So what's the benefits to the patient? Well, they can complete it remotely. What's the benefits to the team? They can concentrate on what matters to the patients, and actually patients get a much more satisfied results, as evidence suggests. And actually multidisciplinary teams can review this as well in terms of designing pathways of care, etc. So this is the most important topic for today, is what is business intelligence. So as we, again, not trying to make assumptions for the audience, but business intelligence is a set of theories and methodologies, architectures and technologies that transform raw data into meaningful and useful information for business purposes. BI can handle enormous amount of unstructured data to help identify new opportunities, to implement effective strategies and provide competitive market advantage. Now, today we're going to talk about, what the evidence suggests around BI capabilities and an assessment whether they support shared decision making or not. So, first of all, as we all know, a lot of these data sets that we talk about in terms of using business intelligence, for example, costing and activity data, clinical outcomes data, patient reported outcome measures, sit at different places in the organization. So we've got to get them together. And hence, interoperability, which I'm not going to talk about a lot today, and data standards are really important. So those are a given. So the question here is, well, BI is absolutely required for co-creation, but is it there yet? So the answer is, I looked at a lot of studies in this area, and of course, based on my experience as well, the typical dimensions of business intelligence application goals in healthcare organizations are, they're used generally for hospital process performance improvements. So for example, improving infection rates, improving surgical process, better leveraging data, improving revenue, workflow, improving cost and time. So there's lots and lots of studies, and some of the sources I have reference to in here. So as we can see, 45% of 24 of these cases suggest that business intelligence is typically used for improving performance. The second case scenario for business intelligence in healthcare is improving clinical care and disease improvement. So, what does that mean? That means identifying patients at risk, improving and optimizing treatment, exploring patterns in patient data, and preventing acute conditions. So, again, 29% of the 24 cases suggests business intelligence application in those areas. The last two, which is analyzing hospital process performance, which is all about quality measurements, and managing better data and communication, is less than 10%. So this is not what I am saying, or this is what NHS Wales is saying, but the evidence trawled through this particular literature also talks about that there is significantly less use of business intelligence in collaboration and co-creation. So most of the, again, repeating this, most of the applications will focus on controlling the quality, measuring adherence to medicines, tracking revenue. But that's not what healthcare is all about. In order to make healthcare sustainable, we really, really need to start listening from our patients and start measuring what matters to them. These are some of the applied BI capabilities and tools. So if we look at the traditional BI capabilities and the tools that deliver them, we've got BI tools doing organizational memory capabilities. And on the right-hand side, you see the typical suppliers for these tools and techniques. We talk about information integration capabilities, insight creation, and presentation capabilities. So all of those typical things, but nowhere here is the capabilities for co-creation, shared decision making, co-production. It's just missing out of the roadmaps for the industry, as well as the consumers of this. So when we talk about the assessment of capabilities, well, I've just drawn this here, and in my humble opinion, we're still at a 2 or 3. So what does that mean? What do we need to do to address this? So, and again, one of the fundamental ways in which healthcare is now changing is using the concept of value-based healthcare. So value-based healthcare came into life when Professor Michael Porter of Harvard Business School and Elizabeth Teisberg wrote a book called Redefining Healthcare, in which they advocate measuring outcomes that matter to the patient's condition over the cycle of the care, and also measuring total costs of care over the care cycle. In publicly funded healthcare organization, Sir Muir Gray, who's from UK, suggests using the concept of personal value, which is the value to the person, technical value, which is the value to the system, i.e. save bed days and reduced admissions, etc., and allocator value, which is the value to the population. So he advocates using this approach. And of course, we need to start using the patient-reported outcome measures at pace and scale to be able to triangulate this information. So what's the conclusions here? The conclusions are that based on the evidence I've shared with you, business intelligence tools need to develop based on shared decision-making principles. Value-based healthcare and measurements, prompts and principles need to be incorporated in the emerging roadmaps for business intelligence provider, healthcare, and the life sciences industry. Now, this will help increase the maturity of organizations to deliver and measure what matters to the patient most. So that's it from me, and thank you. And if you have any questions, please feel free to ask.